Morning everybody, it is buyout day once again. Out is early this time because we didn't feel like we saved enough last time. We got 13 horses last time and we're like, that's just not enough. So here we are again. It's about a week later. We're gonna do it all again. So all the horses have been in the trailer for so long, they don't want to come out because they still think, subconsciously, they still think they're closed. So we're gonna put some halters and lead on them and then leave them outside. So now they're like, oh, we can get out.
Lydia, 2 are completely blind. Okay.
So we get a lot of questions in the comments. Do you guys water and feed them when they get there? Absolutely. Once we get all the horses unloaded, we usually throw some feed down here so they get start walking down here, and then we water them once they're all in here because we don't want them to be stumbling around the water troughs and knocking them over. So once everyone's settled in, we give them some water, and as you see, we're getting them some food right now.
We probably won't go past like this one.
Okay. Okay.
Oh no.
Yeah. Ladies, how much do you want? Let's go 3. You can go keto or IV. Sorry.
So sad. They're getting unloaded. Cody's out there cleaning all the water troughs, making sure there's no algae on them, so then they can have clean drinking water. This poor baby.
This is a biglet course.
Oh.
They ripped the shoes off.
So we have a big lick horse here. What are you seeing with this horse?
Her tail tendon's been cut. Her feet are really misshapen, and we see that when they've been in stacks for a long time. So what they're doing is they're ripping these stacks off and selling the horses. We're seeing Tennessee walking horses dumped all over the place. Texas, we're finding them basically at the end of the show season. They're taking them and dumping them everywhere, and they're really messed up.
Their hooves are just so misshapen. And then you said its tail tendon is cut. How can you look for a tail tendon that's cut?
When you've been doing this as long as I can, you can just look at the position is unnatural compared to another horse, and so I can just tell with the position. I can verify by pulling the tail back that it looks like it to me, and I'm usually like 99% right.
So we'll get it updated.
Yeah. So bad.
So this horse is blind.
Can you call your friend? That would be helpful. You want some water? If we have a whole other trailer, I'm trying to push these guys down. I just checked the tail tendon and it has been cut.
Yeah. So it is confirmed a big lick horse that was dumped because, quote, we take good care of our horses, right? Yeah, no, they don't. They don't care about them one bit. And when they lose, they when the horses when they don't win the competitions, they just dump them, right?
Or they
most
don't
of them.
perform
Yeah.
as well as they want. But yeah, so Dr. Lydia's unloading a blind apparition.
Yeah, I got some footage of that.
Always when these horses come off the trailer, it's like, it's just a horrible thing to see how long they've been there. And this is basically an emergency buyout. We just did a buyout. We just did this emergency one because we found out about these horses. We didn't want them to wait.
So bad.
Separated the blind ones into their own pens so they're not in with general population and bumping around everybody.
You're a good girl.
Okay. Nicole, do you have a B number for me for this chestnut? 186. Okay. Oh my goodness. She's got a backwards shoe on this foot. Sorry.
So why do you think they put them on backwards?
Well, when these horses wear these stacks, it messes up with their feet a lot, so their toes get really long. And so I think they realized like how crippled she was, and they just threw something on there.
Also, in auctions, they'll get a higher price when they're shoed, right?
They can, but she is so lame. I think they were just trying to prevent her from being as lame.
Yeah.
But with the cut tail tendon, we know that she's been a performance big lift horse, or at least trained for that.
Yeah. Her feet are just on fire. This one is. Yeah.
Like you can still see the rafts.
Yes,
because they
you
grow
sure
their
can.
toes out really long with the sacks, and then they split
Like,
off.
look at the front feet versus the back feet.
Yeah.
It's a little blurry. There we go.
Yeah, that would be great. Sorry to change.
So pretty. Look at this big horse here. You can see their hoof is literally a ball almost. It's almost like a ball you can see there. If you compare it to the back feet are relatively normal, but unlike these, it's just despicable. So we got the first trailer in here. There's another trailer coming though, so we'll get more horses.
He just came off the trailer. His feet are terrible. They're like rolled over. Can't really see him good in the shavings, but he can barely walk. And Dr. Lydia and Nicole's got him some pain meds and then some sedation so we can get some x-rays of him and see what we can do.
Here, Tony. You need something for her. I'm Daniel. How to watch you.
Please click that donation button. I set the goal at $1,000. We've got another trailer pulling in right now. Donations are so critical. This is like an emergency buyout. We offer $450 once a month to bring in horses, but we learned about these guys and we're like, they can't wait till the next month. Or like weeks from now to do the buyout. So we're doing an emergency buyout just to help them. But your support is so desperately needed.
So a lot of them, they fell down and they can't get back up because there's so many horses side by side. So they just stay laying down until they get here, and that's what that's the better part of it. But like you see right here, this horse is down and not getting up, which is a really bad sign. It's so pretty.
In the darkness of the trailer, where the crowded shadows groaned, a broken mare lay silent, trampled, left alone. But mercy found its moment. A hand reached through the pain. The human heart was beating, calling out her name. Rise up, broken spirit, you're not lost today. Love has pulled you from the ashes. Love is the way. Saved by grace and kindness, you found your destiny. So be strong, be brave, you're safe now,
Few more left in there. This one might be blind here. There it is, all of them are unloaded. We're going to start doing the intake and separate all the really bad cases from the moderately bad cases and go from there.
The trailer just got unloaded. There was 2 horses that we're really concerned about in there, but there's cancer, there's lameness, blindness. It's really, really sad. They're such beautiful animals, and we pull them out of the slaughter pipeline like that. It's just, I'm glad they're here. I wish they would have never had to go through the slaughter pipeline.
What are you seeing? What are you seeing, Micah? What you seeing?
Some really bad horses, as always. We may even have a big lick horse, so
Pretty crazy.
crazy stuff.
Alex, can you bring me a little bit of hay? From this.
They just sedated. We're gonna be looking at the X-rays for the little donkey that was walking basically on its toes.
Yes. Look at the gas tracks.
What are you seeing here?
So the weight-bearing column of a foot is basically a straight line down. So this bone should be over here, and this hoof should be over here. There shouldn't even be anything back here. So if you look at the way this donkey was standing, this is all the pressure right on the point of that coffin bone. And you also can see gas tracts running right up to the level of the coffin bone. It's just horrific neglect.
Now we're gonna do that front view.
So back here?
Yep.
Oh, her face.
Okay, and then we're gonna go.
Oh, goodness, thank you. Well, the horse is blaming on me, moving rockets, so I like it not to. Okay, I'll lean over.
That'll work.
Are you sure I can
Yeah.
stop?
And then we're gonna do.
What are you seeing, Dr. Lydia?
And we're gonna take some radiographs. I just gave pain medication like 60 seconds ago, so we're not gonna move this horse. She had difficulty getting off the trailer, and you can see this is abnormal, knuckling over. There's a condition called radial nerve paralysis. So there's a big nerve right up here in the brachial plexus in the elbow. Hi, sweet thing. And when that nerve gets damaged, whether you fractured something up here or you have happens a lot in dogs that get hit by a car, they become unable to kind of, see how the shoulder is really dropped? But it's also really firm and hot up here. So I'm worried that we might have a fracture up in our shoulder. I also don't think this horse is able to bend this carpus. So the issue might be in the carpus, the issue might be in the shoulder, or the issue could be in this fetlock joint itself. And without taking radiographs, I can't tell. Her prognosis is going to depend on where the problem is, but you can see the rigidity and the contracture of these tendons. This has been happening for a really long time.
Look how skinny these horses are.
So this sweet mare is about 12 years old. We believe that she was a big leg horse because her tail tendon is cut. So that's one of those hallmark signs that kind of only the big lick industry does, is cutting those tendons. She's very painful, and you can see based on the way she's standing, she's punched with those hind legs kind of more underneath her body. And she's very painful when you palpate her back. Sorry about the background noise. So when we took radiographs, we found that she has a fractured part of her spine up here in her withers. She has some bone chips. I'm not going to palpate it again because that feels unnecessary. But when you palpate right over here, she's got bone chips up here. And that's not just important because of the bone, but it's also important because the nuchal ligament, the big soft tissue structure that runs along this horse's body, runs right over here. So when we have a fracture in this area, we don't just have bone and spine pain, we also have soft tissue pain. But unfortunately, she also is actively foundering. So her feet, you can see somebody chopped these toes off. And again, I have no idea what this horse's history is. I don't know where she came from. I don't know how long this has been going on, but she has more than 45 degrees of rotation. So when we look at the outside of a hoof, we want the coffin bone to be parallel to the outside of the hoof. And her bone is like this and pointing down. Someone has been trying to manage her. So one of the strategies that farriers employ to alleviate pressure when you have founder is to turn a shoe backwards so the weight is on the back of the hoof instead of the front of the hoof. So someone attempted to do something appropriate with this horse. If she was a big leg horse, right, we cannot prove that, and she was in stacks, we know that an acute angle change can result in severe inflammation, which can result in rotation. And so unfortunately for this mare, Greater than 45 degrees of rotation with bounding pulses means that we're in end stage. I can manage acute. We actually have a horse that's having a mild acute founder right now, but when we have rotation and sinking, we're beyond the point where we can get those things back. And it's just heartbreaking. This mare is so young. She has more than half of her life ahead of her, and there's nothing that we can do to get her comfortable. She got intravenous pain medication almost 30 minutes ago, and her heart rate is still above 60, which is very elevated, which indicates that our pain is not well controlled. So I am recommending the last active attendance, and it's just, again, I cannot confidently state that this animal succumbed to these injuries as a result of the big lick industry, but I can confidently say her tail tendon is cut. That's the only instance in which we know that happens. It's not something any veterinarian would do. There's no therapeutic purpose for the horse. She does appear to be a Tennessee walking horse, and her feet do appear to have some severe abnormalities. So really tragic for her. And this next horse also, I'm so thirsty, I think is a Tennessee walking horse, and I haven't checked for a cut tail tendon in that one.
So when you're talking about the heart rate, what's normal for a
so
horse?
Upper end of normal for a horse's heart rate is about 36. Obviously, if you're exercising at all or excited at all, your heart rate can go up transiently, but this horse has had a lot of pain medication and sedation. She's not excited at all. She's very calm, and her heart rate is still 60. So when I worked at the University of Georgia, anything approaching upper 50s was like, you don't just call the intern and the resident, you call the faculty member on board, you pass a tube. That's like something critical is happening in this horse's body. Our pain is not addressed. We have to do something right now. I used to work nights. So heart rate of 60. I feel like we talk about that so often here on Buyout days, like, oh, the heart rate was 88. It's crazy. It's an insanely high heart rate. I do want to mention, one of the other things that can contribute to a high heart rate is hypovolemia, which means you don't have enough fluid circulating in your body, and we know these horses are dehydrated. So I'm speaking as if this is all pain. This horse is also clinically dehydrated, so it could also be related to dehydration, but dehydration by itself in a calm horse isn't gonna make your heart rate be 60.
So when you're looking for a cut tail, what are you looking for?
So normally I couldn't bend, like this is the spine, right? I couldn't bend this all the way up here. And I can palpate scars in here, but I don't think you can see anything visible. So she's got scarring that you can feel underneath. From about here to about here, there's kind of a big bulge. Yeah.
Tails don't bend like that normally.
They don't. I mean, really, the horse's spine ends here. This is where it ends. So your back is not supposed to bend backwards at an insane angle. But what's really sad is they don't transect bone. They transect the soft tissue that's supposed to protect the bone. And then it results in like kind of pathologic fractures. I say that based on the one other big lick horse that I've looked at. He had a bunch of really severe bony changes in his tail. Sorry, I don't have the captain's meat on.
So what did you just give the horse?
I gave 0.5 milliliters of dormocidin, which is an alpha-2 sedative. So this horse already had intravenous pain medication, but now we need to take radiographs of her shoulder, and where she was very calm outside, now she's in an echoey building, and she's calling her back. She has one other horse in here, but we need her to be really calm and still for us to take those actions. I have not assessed tail tendon, but you can see that this shoulder is dropped, and this horse isn't able to pick up and place this foot back. So the main nerve that helps the body figure out where to put this leg is the radial nerve. And in animals with radial nerve paralysis, this is exactly what they look like, where they just kind of drag the limb. We see it a lot in dogs that have been hit by a car. In this mare, when I picked her leg up, I couldn't flex the corpus, so I don't know if she has a fracture up here or a fracture here, or if all of this is just soft tissue nerve damage. So based on looking at her right now, I can say with confidence that she has severe nerve and soft tissue damage, but we don't know what else is going on in there. Where's Hal? Okay, let's move down a little bit. So if you'll hold directly over here, we're gonna get our elbow. Perfect. Tuck it up as high as we can get right here. Perfect. Okay. Okay, you keep going down. We're gonna go right over this carpus, and at this point, you can flip it this way. Tally, can you put, yes, perfect, that's exactly right. Ready? Ouch. Got full joint collapse and a lot of arthritis.
Didn't catch on video, but as it was walking, its rear was just limping like crazy.
And seriously messed up eye.
Yeah.
And this other eye over here has a big cloudy spot, so.
It's probably 99% blind.
Completely blind.
Right on this one, once you get a chance. So
80.
lit. 80.
80
Ooh.
beats per minute.
Ooh.
Okay.
The horse is in serious pain when she walks.
Yeah.
Left ear is not even functioning.
Yeah, her heart rate is 80 beats per minute, so that's,
Bad left eye, bad body right.
So Liz, we see you in the background a lot. What are you doing up here?
I do the Coggins photos for all the horses. It's their blood test that they need to have. And then I also do the social media.
Perfect.
That's so painful.
Poor thing.
So what about our arms and stuff that's not covered up?
We cover up the important bits.
So as long as this right, your organs are. Lost the hands up.
Because you still, if you are in the primary.
oh, yeah, your eye out. That was so thoughtful of them.
Someone beat you to it.
Guys, I think he's blind on the right side.
I detected a little vision over there, but it was more like a sixth sense type of it.
You might be
Do an
blind.
opto exam.
A little bit of cloudiness.
No reaction to it. Maybe
Is there any light reaction?
Yes.
Yeah, he's not doing good.
Your poor self, sir.
Am I taking?
Look, he recently had shoes on. Oh my goodness. Oh my goodness. This poor, I'm sorry. I gotta get some minutes.
So what are you giving him?
I am gonna give him, I already pulled, okay. I'm gonna give him some Banamine. So I actually haven't checked a resting heart rate. He has ulcerated bleeding so badly in his sheath and his penis that the anatomy doesn't even look normal anymore. And his rectum is just fully ulcerated. Like just every time this horse urinates or defecates, he has to push past ulcerated tumors.
We just gave him some pain meds. Poor guy.
I know, I just got you and I'm gonna slap you again. You're a good boy. This gelding is just gorgeous. I aged him about 25 years old, and you can tell he's incredibly well behaved. He's very calm and sweet with people. Someone surgically had his eye removed, so that's a several $1,000 surgery. Someone clearly took care of him. It looks like he's had shoes on until recently because he's still got nails in his feet, but looks like they came off. Tragically, this horse has severe masses on his penis and sheath and also on his rectum. And I know it's not scientific, but necrosis has a smell. So tissue necrosis is tissue death. And when the tissue starts to die, it makes a really specific smell. So I can smell the literal rotting nature of these masses on this horse. And it's just awful for him. I mean, he can't urinate or defecate, I'm sure, without discomfort to pain. He got pain meds right away. He's such a sweet boy. I was hopeful at first. I just saw the mass on his penis at first, which sometimes if carcinomas present kind of right at the distal end, you can amputate those masses and they do okay. But in his case, the masses associated with that are so large and they go up into the sheath that the anatomy is completely abnormal. So I'm not able to tackle that as a surgeon. And then in addition to that, the masses under his tail extend into the rectum. So those masses generally are very difficult to resect, but also carcinoma. Squamous cell carcinoma is the #1 cancer of the eye, and we see it in light colored eyes. So if you look at this horse's markings, he has white over here. So he would have been at added risk for a squamous cell carcinoma of that eye. And if I had to guess, I would guess that's probably the first lesion that they saw in this horse, and they removed the eye and hopefully removed the cancer. But when you have metastatic tumors, so when cancer spreads in your body, it can show up elsewhere. And one of the other common spots that we see squamous cell carcinoma in horses is the 2 exact locations that we see them in this boy. So I can't 100% confirm that it is cancer without a biopsy, but I'm going to do a fine needle aspirate and look at the cells under microscope here at Horse Plus. But unfortunately, I'm going to recommend the last act of kindness for him. Even if these tumors were benign, they're pathologic in that I can't remove them or make them better, and they're in locations that cause him daily discomfort all the time. You know, not being able to urinate or defecate without pain is not an acceptable quality of life. He's a very good boy. He's had a lot of cookies, and he's going to get more cookies. He's not sedated. He's just standing here being a good citizen. So it's really sad. I'm sure somebody loved this horse, and I wish I knew his story.
We just ate a quick lunch. We're going to get right back to it. Dr. Lady is doing some interviews, but we're going to get right back to doing the buyout.
Or both. We'll take whomever. Come on, good girl. It's all right.
I see you doing a lot of x-rays, and you have these little, what are they?
Yes, so this is called a dosimetry badge or a dosimeter badge, and these contain technology in them that's reading radiation exposure. So when we take x-rays, there's radiation that's generated by the generator itself that's supposed to go into the plate. But we know that there's 2 types of radiation we can be exposed to. One is direct, so we don't ever want to put our staff directly in the x-ray beam. And it's really helpful. The technology is set up so there's a light. So I can tell exactly where that primary beam is going to be based on the light of my unit. And when the Tennessee Department of Radiation Safety inspects us, that's one of the things they check to make sure it's lined up. But this basically, so this one has my name on it. It's specific to a user, although we do have a couple spares. And we keep this log so that we know what patient it was, so we can look at the settings, who was holding the animal, who was holding the plate, and who was actually operating the generator. And then periodically we send these back to the company, they read them, and they come back and they tell us exactly how much scatter radiation. So I talked about direct radiation. Scatter radiation is when you shoot your primary beam, some of that radiation can bounce off. It doesn't bounce off lead, so these aprons are lead. So we wear these to protect ourselves from radiation exposure. And we wear these kind of like right up here, so that if for some reason one person gets exposed to an unsafe level of radiation, the state knows, state public health can be notified, and we just make sure. So I've been a vet for 11 years and take x-rays all the time, and I've never had an unsafe level of exposure. But it's part of what we do, both because of regulatory purposes, but also because we take a lot of x-rays and we want to make sure our staff is safe. moly.
I think she's a.
You think?
I could be so.
We got an eye and a whatever that is.
Yeah, I'm just drawing it out.
It's a heavy boy.
Okay, you're ready. I just know. Listen to her. Maybe want to like wrap it just in case. Sorry about your leg. Yeah.
Is it how we're consistent one thing?
Good girl. That was great. That was a very good girl. We think that this mare might have been used as bucking stock. And what I'm doing right now is feeling for a digital pulse, which unfortunately I do feel.
Can you explain what a digital pulse
Yes,
is?
I sure will. A digital pulse, so normally in the very bottom part of a horse's leg, you can't palpate a pulse. There's only certain parts of the body where you can feel. Usually pulses that you feel are arteries, not veins, which makes sense because arteries are under higher pressure and they're kind of pulsing in line with the heart beating. So in a normal horse hoof all the way down here, we're not going to be able to feel those bounding arteries. I think the best explanation I can give, if you've ever slammed your thumb in a car door and it just feels like it's this throbbing, it's a little bit similar when you have inflammation within the hoof of a horse that's contained in a solid structure. You kind of have that localized inflammation manifests itself in the haired skin that's nearby. And in this mare's case, that right front leg has been this way for so long and she really can't bear weight on it. So she's like resting the leg on the ground, but she can't actually step on it effectively. So this leg is holding, so this leg is only supposed to hold 30% of her weight and that leg is supposed to hold 30% of her weight. And that one's holding maybe 10%. So this one's doing 50%. Did I do that math right? 60? Yes. So that's a lot of weight. And what happens with horses, and one of the main reasons why they don't do well when they have a fracture is support limb failure. It's that the other leg can't cope. So we're going to try to take x-rays of this right front leg, but I don't even need an x-ray to see that she can't walk on it, and it is bent to such an unnatural angle and has been there for so long that there's nothing that I can do to correct that. If she were a dog, we would just amputate this leg. In horses, that's really not feasible. And then to make things more difficult, she wouldn't let us touch her. She doesn't show indications that she's actually halter trained. And Sydney actually thinks she might have been a bucking horse. She's got brands on her left shoulder, her left leg, and her left hip area. So I'm not a bucking horse person, but she does not trust people. She does not like people. And she was pretty aggressive and kind of bullying the other horses. So she has a lot of indicators that somebody didn't take care of her. So that's challenging too, because if we're going to provide medical care to an animal, we need to be able to access them. So we're going to try to take an x-ray. Do you think it's safe to even try right here? We're going to try to take an x-ray. But what I suspect at least is going on is soft tissue. So x-rays show us bones. And based on changes in bones, we can make a lot of assessments about what's going on with soft tissue structures, but I don't have to do any diagnostics to look at this and say something extremely wrong has happened with the soft tissue structures in this foot. Maybe it was a club hoof. I suspect that it was a traumatic fracture.
So I've seen in the past someone was asking, why isn't amputation feasible?
So there are a few cases where horses have undergone successful amputations and were fitted with a prosthetic leg. What's difficult with those guys, and if you look at the long-term success rate, there's no long-term success rate. So I think the best case scenario, and if you're watching this and I'm wrong, please share the happy amputation stories for horses. But even the ones that I know of that have been fitted with a prosthetic limb maybe have another year. And in a lot of cases, it's a painful year. I have not undergone amputation of a limb, but there's nerve pain, there's compensatory pain elsewhere in your body where you're trying to figure it out. And then there's the risk that this other leg is gonna fail, which in this mare's case, it's already failing. So she doesn't have another good leg to stand on. I think the question that I ask myself is it fair to the animal? So it makes us feel better to think about an amputation, because in many species you can have an excellent quality of life while missing a limb. In horses, there's the fear factor. They're prey animals. The inability to easily get away significantly changes their mental state. So to take a horse and put them in a situation where someone has to put your leg on for you to be able to run away means that there's likely going to be some anxiety there. But yeah, it doesn't seem fair to me. I think if you could ask horses, hey, would you like us to cut your leg off? They'd be like, no, I really would rather just die. And I think it's okay to say that. Just because we can do something doesn't mean we should. I know basically no veterinarians that would agree to amputate a horse's leg. But again, like, I don't know what's out there, so prove me wrong if you've heard happy success stories. Cows, some cows do better. Some tiny mini horses that don't weigh a lot do better, and a hind limb is easier than a forelimb. So it's not that it hasn't been done, it's just that it hasn't been done successfully, and especially not looking at the long-term quality of life. All right, come on. Okay, so anybody that's not actively trying to get him, if you could stand next to each other or like to the next one, that'd be great. Friend. You kind of naughty. Hey, at least you're sound. Yes, she does. It looks like someone cut an agent. You don't need to be turning around. Not even a eyeball.
It does look like an egg.
Yeah. All right, well, let's see if we can get a hold of her. Listen, sir.
We did that with the boys.
This feels excessive. Look, we got cookies. You're fine. Oh, yeah, okay. Well, you cookies. You're all right. You're okay. I'm going to go out on a limb and say we might have to squeeze this friend to get a blood sample. You want a hug from the shoe? So this little piebald mini mule squeezed between, it's like a foot. It's like a space right between the end of the chute system and the door, and he just squeezed through it. You got him right back in. He's not happy about it. I almost thought for a second, if he feels bad for
So what are you trying to do here?
So this little guy has a wound on the inside of his left hind leg that's draining some material. And he won't even let me touch his tail, so I can't really touch it or provide wound care. It looks like it's on its way to healing on its own.
Lydia, I'm just gonna need you to double check a page on that.
Got it. I think I want to run a CBC and give an exceed injection, but let's keep him up because if he, man, I would love to culture that. Nicole, yes. See your face. You got all your adult tootses? Can I see them, please? He's like, nope. I think.
So you say he's about 3 years old, so he's acting like a toddler, throwing
That's
a
right.
temper
So
tantrum.
the eruption dates of the teeth are 2.5, 3.5, 4.5. So his 2.5s are in, his 3.5s haven't started coming in. So I'm aging him at 3.
So he's acting like a toddler with a pity party.
Yes, he's a baby. Kind of like perpendicular, and then you have good flow without holding on.
Well, that's nifty.
I don't know.
Well, it's on video if anything happens.
I'm just gonna try touching and see what happens.
So are these just all vaccines?
Yes, I know. It seems like we're poking him with so many things. This is Exceed. It is a broad spectrum antibiotic. And then we're vaccinating him against rabies, strangles, and 5-way, which contains vaccines against Eastern equine encephalitis, Western equine encephalitis, West Nile virus. What else? Eastern, Western, West Nile. Tetanus.
Doesn't have flu in there somewhere?
Some of them do. I think this one does. I gotta get this microchip up here.
Dude is not having a good time.
I'm sorry. You're so swift. Oh, you're so swift.
All right.
So who was this and what are we looking at?
This mare was the one that we suspected was from bucking stock. She was a big chestnut draft cross.
191.
B25 191. And she was all the way knuckled over and trying to walk on the fetlock of her right front leg. And these are her radiographs that Nicole just took, and they're heartbreaking. So her coffin bone is just resorbing and missing in some places. See how irregular and just kind of moth-eaten this is? So that, to me, I'm not a radiologist, but to me this looks like classic osteomyelitis, which is bone infection. So P1, P2, and P3 are all infected and actively just crunching. So she was walking right here. This is where any of the pressure on that foot was pushing right here. So picture how incredibly painful that must have been for her. And she also was just really distressed.
What does she look like?
Wow. That's exactly right. Thank you. If you can even orient. Yeah, Nicole did these. Here we go. This is what I'm supposed to do. Obviously, this is the other foot. So you have to picture it, this way, but like this bone should be here. should be here.
We're gonna have to use the squeeze chute 2 times today.
That's so tragic though. I mean, like, an animal that has not been eaten by a human doesn't do that. Like, I think that carcass is undisputably broken. Water hauler said that he was really limping really badly. His left front carpus is visibly angled in an incorrect manner, as well as probably twice as big as it should be. So I haven't taken x-rays, but I think it's safe to say that he's got a fracture or at least severe arthritis associated with that carpus. I have no idea how old he is, and I haven't done any other exam. You can see how scared he is. I mean, he's showing the whites of his eyes just standing in here. And then when you try to touch him, he flinches like you're gonna hit him. So it's really, really horrible.
Are you okay if I sedate him first?
Yeah, please do. I'll unsqueeze him when you let me.
Any promises?
She's a little jumpy.
She's barely sedated though. I gave her 0.2, so.
She's like, this morning, I was like, yeah, no, my God, this morning. It's like, not a good choice.
I think that's your mama coming in.
That's her mom. That's gonna be an old horse.
Yep. Thank you.
Yeah, Mr. DP. Oh, yeah. You don't got a lot of teeth left, but you got some.
She's missing some premolars, but no microchip. But she's about to have one.
Yay. Getting a haircut.
I've had worse happen to me. I know. Yes. Okay, I'm really sorry. I'm sorry for scaring her.
Giving her all her vaccines.
Good girl. I'm scared. I'm really sorry. I'm coming over here. Those parasites. She looks like she was used as a brood mare. She is blind in both her eyes. All right, good girl. She's blind in both of her eyes, and I think that she is a candidate for enucleation, which is surgical removal because the eyes are shrinking. You can see all the scars on the cornea, and then you can see her lids rolled in. So if you watch Horse Plus videos, I talk about this condition a lot, and tropion is when the lids roll in and then the eyelashes rub against the cornea itself. The cornea has a ton of nerves in it. So if you've ever scratched your eye, it really hurts. These guys live with the pain of having scratches on their eye, sometimes for years. So this mare cannot see at all. There's 0% chance she'll ever see again. And her eyes are hurting her, both of them. Her resting heart rate is normal. So sometimes horses come in and we're like, this eye's about to rupture. We got to take the eye out like tomorrow. I wouldn't put this mare in that category. She's probably been blind for years. But if she does make it to adaptability, I would rather remove her eyes here at Horse Plus to make sure that she doesn't have future problems and more pain. Her heart and lungs sounded good. She's very dehydrated, so we're gonna run some blood work on her today. These guys are often really thirsty because they can't find water. You know, they go through slaughter auctions and then they can smell, but there's a lot going on. So we're gonna try to get her rehydrated. He came in with this other blind happy, and they look really similar to one another. We should measure her, because if she's a pony size, she would be a pony of the Americans, technically. She has some swelling on her legs. Looks like she's had some chronic diarrhea, and she's just extremely thin and hasn't been cared for well. But I'm hopeful that we can get her turned back around. The guy the slaughter hauler said these guys kicked, but they're blind, and she's been lovely. Once she had a place to feel safe, she let me do her whole exam and has been a really good girl. So, and there's no way to tell. I guess we could run like genetic panels and see, but I'm curious to see how old that horse is. They could just be buddies. But anterior uveitis, which I can't prove, but I suspect is what this mare is going on, sometimes has a genetic component, we believe. So it makes sense that if they're related, they both have the same condition. Good girl. What?
Does it help if your microchip?
Here. Okay, we're almost there. Girl. You're okay. Girl. Okay, easy. You gotta sit down and time it. Good job. Good girl.
So I'm holding this horse behind me, and there's one more horse in the chute. It's also a blind appy, but that's the one the vets are going to do next one. This one is waiting its turn, and the interesting thing is it's got a big old grocery on the side. This seems like a super sweet horse, but everything's going really well. We've still got another almost hour and a half until the vets need to stop for paperwork and things like that, so hopefully we get most of these horses done. But we've done the most critical ones now, and we're on to the ones that are hopefully in much better shape.
Alright, let me get out.
I don't know why that was like
Okay, girl, yeah, she responded with that. She don't get with the kicking, right? Easy, you gotta step up. Step up. Just remember, if she kicks this gate, you'll know it. Okay.
Okay, I'm touching your gate.
So I went here because this is where I stuck before I didn't get fibrosis. This didn't feel like it was fibrotic, but you went through there and it was crunchy.
So did you just sedate him?
I did sedate him a little bit. We need to take radiographs of his feet.
So we got that one in. We're closing that door. We sedated him so they can take x-rays of his feet. So they just took the x-rays.
So wait, do you want the other foot? No. So, okay, so you can come off this.
What are you seeing?
Another really sad end-stage founder case. So this is the coffin bone. It's supposed to be parallel to the hoof wall, and it is rotated. This is the second big lick horse we've had today.
Seems like a pattern, doesn't it?
With severe rotation and lipping, and then also sinking. So you can see, like, this is the outside. That's the outside, and this bone is almost communicating with the outside of the horse's foot.
That's
His
okay.
GI cells are absent.
Thank you.
So he may also be colicky in addition to the Bunny, I'm so sorry. Oh yeah. See his mucous membrane color? See how it's muddy and purple?
How old do you think he is?
That's kind of slow, is it?
CRT is about 4 seconds. Yeah. He is probably 26 years old. And I know I'm not wearing gloves, you guys. I'm about to wash my hands. So, Sydney, this is a good one for learning. Because it looks like Galvani's groove is at the top. If you feel it, it's not. It's super smooth until like past half.
Yes.
These are blinding. Oh yeah. No, you can't see it all. Hi, handsome boy. Oh, hi, big boy.
Gentle giant.
Yeah, your nose is kind of gross.
Yeah, he's the one that snotted all over my arm.
Yucky.
Your back hurts? It's okay, I'm not gonna get on you. You don't like that? Okay. That's okay. You don't like your respiratory rate?
I'm standing away from that nose.
Early to mid 20s, but I'm gonna look better before I commit to an answer. I'm coming back to say it's me. Good boy. How about this? Can we be friends now?
Oh, yummy.
Okay, I know. 23. I know I tricked you. I'm sorry about that. I know, it's very rude. Why are you breathing so hard? You can't give anyone else this cookie you slobbered on it. You can eat it. Okay. 18, 20-ish. Okay. Obviously with exercise, respiratory rate goes up, but 60 is, like sometimes in a young horse at rest, the respiratory rate's like 12.
So what's the respiratory rate on this horse?
60 breaths per minute. And he does have both inspiratory and expiratory sounds.
So it's just about a breath in a second. Breath in and out in a second.
Yeah, if you watch his flank right here, he's kind of almost panting. And you can hear his lung sounds both when he breathes in and when he breathes out.
Yeah.
I can't even see, and you're stuffing stuff up my head.
So what do you do that for?
So I am going to send for a bacterial culture of this nasal discharge. And I don't know if you can see, this horse has like big swelling underneath his jaw. And I'm gonna try to culture that as well to see if we can see what bacteria is growing. What I want to know is, like, is that one big abscess? I want to see if you can see a gas tract to tell me where to swab. Okay. He's been really sweet, but I haven't sedated him. I might sedate him a little bit for head rads. Thank you. All right.
Give him a little bit of sedation.
My day has been absolutely so great. It's like one of the greatest days I've ever had rescuing, because I actually got to be out from behind the camera and I got to actually catch horses and hold horses and help unload and problem solve and, you know, do all the stuff that I've been doing for almost 23 years now. And so it was a nice break to get out from behind the camera, let Justin do all the filming.
You'll fire
And I
him.
get to tell him how to do that and what angles to get, but I don't have to tell him much because he already knows. But this horse right here, poor thing, its respiratory rate is like 60, which means it's breathing in and out once a second. And that is really abnormal for a horse. Normal is 18 to 20 at a resting heart rate. So he's got something major going on. And I don't know what she gave him, but it looks like he's getting affected. But they're going to be doing some radiographs on him, getting some x-rays. And my day's been good though. But we are wrapping up. This is the last horse the vets are looking at today. So they're going to be getting all the photos of the other horses. And we'll be wrapping up here in a little bit.
Okay.
Okay.
A lot of movement. I do not like how he is breathing.
Bullshit.
That was not diagnostic. Sorry.
You need me to go.
No, it wasn't you. It was me.
Yeah, I don't love this movie.
No.
Okay, don't fall over. You barely stand
All right, let's try to give him a little bit more support. Sydney, can you loop something under his jaw? And just, like, I just can't interpret anything because it's too much movement.
I can put some lead on.
Like, I would almost call this an adverse drug reaction, except his respiratory rate was already 60.
Would that be in the way?
Yeah, I don't think I don't need it around his neck. I just want it around his nose, and I would just like
You can probably just take this whole thing.
hold his nose up. You can't see, so I don't think he's going anywhere.
See if I laterally buddy?
Yes.
There we go.
Oh my goodness, I don't have any diagnostic images. Okay. I don't know what's...
Charge the battery.
I keep getting way too low. I need to get higher. Yeah. We need to do a fundraiser for some new batteries. Okay, that was diagnostic. Need to move down a little bit. Down towards his nose. Yep.
Better when I hold it. This little horse is number 200 horse for the year through the Buyout program. And we are so incredibly grateful for each and every person who's donated to help us rescue these horses. This is a precious little horse. Let's hope everything's okay with this horse. But I think at some point somebody did something to her, because she seems to know a little bit what the halter is. But this is what it's all about, is getting these young horses and helping them and giving them a bright future. Today has been something else. 20 horses and then a mule and a donkey. So 22 total. A lot of really sad cases today.
Yeah.
But we have some young horses here that our fingers are crossed for. There's a lot happening within the horse slaughter pipeline that we haven't been talking about. We've been documenting it for months, and we hope to let you know why we're seeing what we're seeing here soon. I know for years people have been like, well, hey, why are there so many skinny horses in the slaughter pipeline and stuff? And before I was like, well, they're kind of just bouncing from auction to auction and the skinny ones get dumped off. And now we're learning what's actually happening, which we'll be sharing soon. So just want to thank you for sticking with us through this time of I mean, it's emotionally really tough rescuing horses in this condition.
Yes. I think the term shell shock or like triage medicine definitely applies for me. I have to, you never shut your heart off, right? But in order to be present for the next patient, and there's always a next patient on these days, you have to just keep moving. I always process, hi, I don't have my cookies. I process kind of the emotional side of these days separately from intake. But we had a lot of really hard goodbyes today and a lot of horses that were just in deplorable, inexcusable condition that had been painful for a long time.
And typically our buyouts aren't at the beginning of the month, but we learned about these horses and we're like, we have to help them.
Yeah, Angela said, or was it you? Our staff takes some time to recover, but the man who had these horses sent pictures of us to our organizational management, and we had to say yes. We couldn't let them.
No, they couldn't wait to fit into our schedule. We needed them
Yes, it's a good way of putting it.
Yeah, we had to figure out how to get them in and make the schedule work. And just please keep donating. And I hope you've enjoyed this almost live video. Give Justin your feedback. Anything you'd like to see differently.
This horse is like, we would like more cookies.
More cookies.
Signing up for the cookies.
Check the Amazon wish list for cookies. And thank you so much for watching.